Swayam Prabha. Digital India. Educated India.
Speech-language therapy clinical services are essential for individuals of all ages, from children with developmental delays to adults recovering from strokes or injuries. They play a crucial role in early intervention, educational support, and rehabilitation in medical and community settings. Today, we are going to meet the team leader of a team of innovators that has worked to bring about innovative ideas in this domain. So let's meet Yash. Welcome to the show, Yash.
Thank you.
Okay, Yash, so before we begin, let us talk about the problem area that you worked upon. So kindly describe the problem to us and how grave the problem is.
Correct. So, as you rightly told us in the introduction, it was a very impactful domain, and we were looking for problem statements on the SIH 2024 website, which would help us to contribute to a real world cause. And speech language therapy is a very core domain in which the end-to-end automation for the patient, right from the registration in the hospital till the progress of the cases and at the end for the patient to be cured, is a very chaotic task. So we wanted to automate it and simplify it so that we help the institutions in providing this social service efficiently and seamlessly.
Okay, that's nice to hear. So the area of the problem, how big is that? How many people suffer from this, or any kind of a data set that you have, or in general, the enormity of the problem, if we need to understand, how do we understand that?
Correct. So generally, these types of health institutions have a OPD IPD setup wherein the student therapists are also contributing to help the patients in their treatments. But the issue that we tackled over here, also which was the primary issue that we were tackling with this problem statement, was there was a shortage of supervisors that were there to mentor and guide these student therapists. So we wanted to have an end-to-end system wherein the student therapists can log into a portal, and through that software automation, the student therapists don't have to take the manual paperwork to the supervisor for guidance, and they can actually have a smart platform in which they can talk to the supervisor virtually, saving time for both the students as well as the supervisors.
Okay, so if you have to understand this, how does it work? How do you make it work at both the levels? The user level as well as at the other end of the spectrum.
Correct. So whenever a patient reaches to the hospital, they meet a compounder or a chief supervisor who will log on them onto the portal. And then once the supervisor will have all of the credentials, the supervisor will find the right student therapist that he or she can assign the patient to. And then the particular student therapist who is assigned can do the data logging, that is taking on the basic information and then submitting it to the supervisor. And the supervisor will then just divide the entire treatment plan into several phases. Let's say, for example, a patient's treatment is of 5 phases. So after every phase, there will be a report that will be submitted to the supervisor by the student therapist. And the supervisor will then give feedback and guide the student therapist and also assign a new student therapist for the next phase of treatment till the patient is completely cured.
Okay, and what all was required to put this up in terms of technology stack as well as the team? So can you just help us through with that?
Correct. So while we are engineering students, we don't have practical exposure to how these institutions work. So the most important step that we took was to actually go out into such institutions on field and conduct user interviews to better understand what they actually need out of a software platform. And then we divided the work into 2 parts. That was the web development and also the software development for automation. So we were a team of 6 comprising of me, Yash Buddhadev, and my teammates Samir Gupta, Vatsal Kota, Harsh Chatalia, Vinti Bhatia, and Parth Gala. So 3 of us were working on developing the platform, that is the web and app development part of it. We had both the options to either have a web page or also have a mobile app. And while the other 3 of us were developing automated software that can be integrated into both the website as well as the app for ease of use of both student therapists as well as the supervisors at the institution.
Okay, you said you went to the field and interviewed people. So let us understand more about a bit of this research that you've done. What all did you gather from the field in terms of what the problem areas are, how they can be dealt with, and what currently other options are there in the market which could help these people? So what all did you gather from the field?
Okay, so we came across this amazing example that I would love to share over here. So we actually understood from the hospitals that one type of cases that occur frequently is a child is brought onto the hospital for a speech language treatment who is like 5 to 7 years old, and they go on with the treatment for the next 3 to 4 months and they see some sort of improvements and they leave the therapy in between. They do not finish it. And now they have to come back after 4 to 5 years when they're encountering similar issues again. So one hassle for them is to find out the previous case files, which is currently manually stored in terms of handwritten documents, and so they have to skim through hundreds of files to find that patient file. But if we automate the entire procedure, we can just have a search query wherein we can search the name of the patient and we can get all of the historical data of that patient. So that was one very interesting use case that we found out from the user interviews. Along with that, also when we are automating the entire onboarding process for data logging, we have to understand what kinds of forms were there for patient to onboard, what were the uh, parts of information from the patient side required, so we can then curate a software platform that has the exact same values and the fields while logging on the patients on the web page.
Okay, so good job, it seems. So what impact do you think it's going to create on the health industry and the people who would be using these platforms?
Sure. So it would cut down time for the supervisors so they can work smartly now. They don't have to go to 10 student therapists and actually read through their manual handwritten files and then guide them for a particular patient. They can have all of those student reports coming directly onto the software, and a software can also summarize the entire report and give a positive and negative sentiment. So the time in skimming through the files is now cut down 50 to 60 times. And also for them to provide feedback and to just send it on the software so the student can get a message. That also reduces the entire working time by 70 to 75%.
Okay, yes. So currently, are there any similar applications or solutions available to the people? And if yes, then how do you compare those ones with yours?
Sure. So there could be some B2B solutions as software as a service, that is SaaS, for such institutions. But the key over here is customization, because every single health institute has their own way of working and they have their own sets of patient onboarding as well as patient treatment, and they have their own way of report curation. So it is very specific from institute to institute. So it's actually a task to go to their institute, collect all the data and the styles that they use in terms of the entire treatment plan, and then curate a B2B SaaS platform that is replicating their exact manual workflow and style into an automated software. So that is how we are different.
Okay, so now, I mean, having understood your innovation thoroughly, now let's come to the SIH part of it. So how was your experience at SIH and how did that experience help you come up with this solution?
The experience was overall very wonderful and empowering. For students our age, we were in the third year of a college and we were exposed to such real world cases wherein we got the esteemed opportunity to actually work on a problem statement that could be very much implemented in real life, and we can actually bring impact for such student therapists and supervisors and actually make them more efficient in what they do, and what they do is to help people who are suffering. So it was an amazing experience overall.
Okay, going by the time that you spent during that hackathon period. So how did that go? In the sense that there were mentors giving their feedback, and there were judges giving their feedback as well as judging your project at every stage. So how did that go? I mean, were there any lacunas they pointed out, or some discrepancies they pointed out, or were there some situations where you had to pivot, you had to kind of redo something? So how challenging was that?
Correct. So coming to that part of the hackathon, we had multiple mentoring sessions as well as judging sessions. So usually judging sessions, people need to be more prepared because you are also evaluated in the judging sessions. But the mentoring sessions are very helpful because they guide you in terms of the direction that you are headed while developing the solution. Is it correct or not? And what can you change, and how can you more optimally approach the problem that you are working on right now? So that really helped. And a very good example for that is in one of our mentoring sessions, we were told to just lay out the foundation of the entire software before we move on more towards the automation, because the key over here was to automate the entire thing in terms of having a software that helps the student therapists interact with the supervisors, and the automation part can come later onto it. So that really helped us to focus more on developing the software and then following up with the automation.
Okay, so overall, were you confident from the very beginning that you're going to win it, or you thought there was stiff competition around? Because, I mean, there are smart brains in such competitions.
Sure. So we were doing well, but then the only thing that we were focusing very strictly on was the direction that we were headed in, because we just believed that we had broken down our entire goal into subtasks, and we were just following up on completing the task as and when decided in terms of a timeline. And we just kept on doing that, and we just made sure with the mentors and judges if we are headed in the right direction, and if this is something that could actually add value to the problem that we were solving. And that was it. That helped us reach the end goal more efficient.
Okay, great. So now tell us about your future plans. What have you thought about it? Do you think this can be, commercialized? This can be, turned into a startup, or how do you want to take this forward?
Correct. So we were directly in talks with the same institute that had listed this problem statement, and the end product that we presented in the final pitch, they were very much happy, and they very much liked in the direction that we were headed, and it seemed that it could actually help them optimize the entire day-to-day functioning of the institute. So we do see it as a startup, and we do see it as a tool that can actually help such health institutions to have a seamless management in real life.
Okay, so any steps that you've taken in that direction? Any contacts that you try to build up? Any plans that you've made?
Correct. So we are in discussions with the same health institute to run a pilot so that they can actually have a trial and see how much this solution will automate and make the entire process optimal for them to try out. So that will be a couple of months pilot, and then we can discuss the further steps.
Okay, great. So we really wish you all the best, and we hope that you will soon be in the market, helping people with this wonderful project of yours. And thank you so much for joining us today, and congratulations on winning your SIH title this year. And
Thank you.
We wish you all the best for the future also with this project. Great,
Thank you.
Yash. Thanks for joining.
Thank you. Thank you so much for your time.
Thanks. Software for speech language therapy clinical services can be a boon for delivering effective, accessible, and personalized care. With digital tools, therapists can offer remote sessions and reach underserved areas. This will not only improve therapy outcomes, but also enhance efficiency and overall quality of care in speech and language intervention.